News just in, the Health Ministry has confirmed 2 more cases, bringing the total number to 77. Director of Medical Services at the Ministry of Health, Kenneth Mark, spoke to reporters where he outlined the current situation in Singapore.
I'm happy to share that 5 more patients have fully recovered from COVID-19 infection and were discharged from hospital today. So in all, 24 have fully recovered and have been discharged from hospital. 53 patients are still in hospital. Most are stable or improving. However, 4 are in critical condition and they remain in the intensive care unit. We will continue to provide the best care to these patients still in hospital. As of noon today, 17th of February, the Ministry of Health has confirmed and verified 2 additional cases of COVID-19 infection in Singapore. Of these, 1 was among the group of Singaporeans who were evacuated from Wuhan on 9th of February, and 1 is linked to a previous case.
The ministry also announced that 5 more patients have been discharged from hospital. In total, 24 have fully recovered. Now we cross over to multimedia journalist Farzana Friday, who's at the Ministry of Health. What can you tell us, Friday?
All right, so Olivia, 2 more cases of the coronavirus infections have been confirmed in Singapore. This brings the latest total to 77 cases. I'm joined here today with SD journalist Timothy Goh, who sat in for the briefing. Now, Timothy, you've been following the coronavirus infections ever since the outbreak. So one of the cases that has been revealed today was a one-year-old who was evacuated from Wuhan on February 9. Can you elaborate more on that case?
So the 1-year-old is the first of 174 passengers that were evacuated from Wuhan on February 9th by the second Scoot flight that was sent there to bring Singaporean residents and their families back home. They were diagnosed on Sunday with the virus and they are currently at KK Hospital. Aside from the 1-year-old, there is also case 77. He's a 35-year-old Singaporean man with no travel history to China who is a close contact of case number 50, that is the DBS employee. Who was the previous case. As of today, there are only 4 people in critical condition in the ICU. That is down from 5 cases yesterday. And 5 more cases have been discharged today as well.
Okay, so Minister Lawrence Wong actually mentioned that a few people still leave the house and go to work despite having some symptoms. So could you share about some of the symptoms that they can look out for as well as precautions that they can take should they have any symptoms?
Definitely. So some of these symptoms are what we call common respiratory symptoms. So that includes a sore throat, a runny nose, a fever, a cough. And the issue with this is that a lot of people think, I've had these symptoms before and so I can carry on. But at this period of time while the virus is going around, that's really not a good idea. Instead, what you should do is you should see a doctor immediately and get an MC from them. They are not supposed to give you 5 days worth of MC if you have any respiratory symptoms. And if after your MC you're still not well, you should go back to the same doctor again to get reassessed. And you should not doctor hop or go around into public spaces or crowded areas.
Okay, so we're seeing a drop in the number of cases that are revealed daily. Now, with this number of fewer cases, can we expect an end towards the outbreak or can we expect fewer cases from now on?
Unfortunately, no. It's too soon to say. We did ask them just now, but as the experts mentioned, the numbers that are coming in every week are too small to be significant to observe any major trends. So all we can do is hope for the best at the moment, but not rush to any conclusions.
Okay. Thank you for joining us today, Tim. Back to you in the studio, Olivia.
Thank you very much, Friday. That was multimedia journalist Farzana Friday as well as journalist Timothy Goh reporting from the Ministry of Health.